Botox is it's a product produced by Allergan, very well-researched product. Obviously with that comes a lot of proof that it's safe, very safe product. It is not a permanent effect. The Botox usually lasts a good 3 to 4 months. A lot of people it lasts up to 6 months, some people even longer. It's very good for the upper part of the face. It is very good for the frown lines up here, what they call the glabellar lines, the number 11 that a lot of people have, and then also for the crow's feet, the smile lines. I don't like it to overdo it. I don't like the whole Hollywood look, if you want to call it that way, and make people look unnatural. Yeah, just kind of freshen you up. It takes about 4 to 7 days, and I like to see people about 2 weeks after, just to make sure they're happy with the result. And then, yeah, slowly over that time, the Botox kicks in, and most people are extremely happy with the results. Juvederm, which is basically hyaluronic acid, which is a normal product, a normal substance in the skin that is usually there to cause firmness in the skin. So with aging, it goes away. So with all these kind of things we can do, you're basically just giving back what time is taken away. So one can do a little bit just along the line of the lip, so it expands it just a little bit. Or one can actually fill the lip a little bit, so you can make your lips look a little bit more full. And one can do that in a really minimal way that it actually just looks natural and your lips just look a little fuller. The Botox, mostly 3 to 4 months. The Juvederm lasts a bit longer. The Juvederm's effect is usually immediately. That's the one difference as well. You see the immediate result. Whereas with the Botox it takes a few days. And then the Juvederm lasts, you get the longer acting one, where it's the Volbella part of Juvederm, the only one that's been shown to, even in the lips, last as long as a year. In the cheeks, those areas, even up to 22 months. I usually tell people about a year for the longer acting one. There is ones that last a bit shorter, but yeah, the newer product is a higher quality product and seems to last quite a bit longer. There's people coming in from the age of 25 till the age of 75. There's a wide range of people where you get the younger people in their 20s and 30s that's just starting to show some lines, and if you start to get them paralyzed at a younger age, you get them not to form permanent deep lines, you can kind of keep them away and keep them staying away for a longer time. It's really not an uncomfortable treatment. I use extremely thin needles. It's the thinnest diabetic syringes you can get. Yeah, it's almost like a little hair, so very small. I also draw up my syringes individually. When I draw it up, I do not go through the little rubber of the can, through the little bottle. I do not let it touch the glass of the bottle. So that needle hasn't touched anything. It goes into the skin once, and then I take it out, and that one gets thrown away. Many other people that do these procedures use one syringe, so the needle gets a little dull as you go, and it obviously makes it a little bit more uncomfortable. So it is also more accurate, I feel, that's just my personal opinion, on delivering the amount of Botox in every injection site, that you cannot accidentally give too much in one area. Yeah, so it is very comfortable. People can come in quickly in their lunchtime, get it done, and then go back to work. The consultations is about half an hour, and it's completely free. Even if you just want to come and ask about it, there is no cost for the consultation at all. And then if we want to do the treatment on the same day, we can usually squeeze that in, because as you see, it is not a long procedure.